Hi Beth, it's lovely to meet you and talk to you today. I just wondered if you could give us a little bit of context around why you decided to do something, research studies around alcohol and older people.
So when we think about alcohol and harmful drinking, usually what we'd probably think about is the younger age group and the binge drinking. The age group that experiences the most alcohol-related harm in the UK and in lots of other countries is the older age group, say the over 50s. So the highest rates of hospitalisations and deaths are amongst the older age group in the UK. And there's a number of reasons for this. As we get older, our tolerance to alcohol decreases. And then older adults are also more likely to take medications and have medical conditions that can be harmful when combined with alcohol. And then finally, when we're thinking about our most recent generation of older drinkers, we have the baby boomers who have far more liberal views about alcohol than we've seen with previous generations of older adults. So they're more likely to be drinking at harmful levels as well. And these issues mean that levels of drinking that might have been safe to us earlier in our lives can actually become harmful as we get older.
Yeah, I think that's what's interesting about that is I think a lot of people do understand that 14 units a week is okay. Mm-hmm. And then the government guidance goes on to say, I think, try and have 2 or 3 days non-alcohol. Mm-hmm. But what you're talking about is because you're aging and your physiology is changing, then actually you might be better maybe saying to yourself, as an older person, that you should be having maybe 6 units a week. I'm not sure that is a message that comes across really clearly through public health. Mm-hmm. So maybe that's something in the messaging that needs to be worked on in the future.
Yeah, in a number of countries they do have older adult specific guidance for drinking, and it tends to be about half the amount that the general population would drink. The thing is that it's so individual, those particular factors. Everybody ages at a different rate, so our bodies will be affected differently by alcohol at a different pace. And everybody has their own individual conditions and their own individual medications that interact differently with alcohol. So it's very, very individual for older adults how much specifically would be harmful to them.
I think there you come down to the role of the specialists and the GPs in how do they talk to people when they come into the surgery about what they're doing in terms of their lifestyle choices. Mm-hmm. I'm not sure how much time is available for lifestyle chats, really, in a GP surgery nowadays.
Mm-hmm. They often ask us about how many units we're having and how many drinks we're having. How many units are in the drinks that we have varies greatly by drink and also by how much we're pouring for ourselves.
Absolutely. So I remember, it was about 4 years ago now, I decided to get one of those little measures mm-hmm. from Drinkaware. Mm-hmm. And I thought that would be really, really useful. And I have to say, I thought to myself, well, I thought a unit of gin was a lot more than it is.
Yes.
So, it was a real learning curve. Mm-hmm. So I think there's also a really interesting thing about partners and carers and what they notice about the change in somebody's behaviour mm-hmm. as a result of alcohol. Did you pick up anything about that and whether carers were noticing things that perhaps the person wasn't noticing at all?
Yeah, I think it can be very mixed. You've always got the accounts that people have about their nagging partner kind of thing and them keeping tabs on how much they're drinking. But when we're thinking about people whose drinking might have escalated and they're recognising their drinking might have become a bit more problematic to them, often they hide it quite well. And certainly when I was doing the COVID research, and there were people who we were interviewing whose drinking had escalated during the pandemic, a lot of them did speak about how they were very surprised that their partners hadn't noticed their increased drinking, even in such close quarters as during isolation and staying at home orders.
Also, I was really aware, because of the work I do, that the AA, I think by about May, had come out with stats that said 28% increase mm-hmm. in people drinking and calling them about their drinking mm-hmm. during the first part of the COVID pandemic. And then by November 20, Balance, which is a North East organisation, was saying, actually really look at the alcohol and what you're drinking and what you're doing. So I think that will be related to the kind of research that was going on at the time mm-hmm. and the stats that were coming out from ONS as well, I think.
So I did a study on this during the pandemic, which was in partnership with the Department for Health and Social Care, which was really exciting to be able to deliver. And that demonstrated that there was a subset where the pandemic really did escalate alcohol use for for a subset of older adults. So it was about 32% of older people increased their drinking during the pandemic. There was another subset, somewhere in about a fifth, actually reduced their drinking, and that was, I think you touched on this earlier, that was people who recognised that their drinking might escalate during this really stressful time and actually kind of tried to buckle down on their health behaviour, make sure that they came through it as healthy as possible. But certainly that 32%, it was particularly amongst the younger old, so people who might still be in employment, who are now working from home. And it was kind of effectively like a pre-retirement. They had fewer constraints on the drinking again. They didn't have to get up in the morning so early. So if they had a few drinks the night before, then it didn't matter so much. So yeah, I think often we don't, when we're thinking about the older age group, might not be thinking about the people still in work, but that aspect of the pandemic did have a big impact. It obviously was also a very, very stressful time, particularly for older adults who in the UK were highlighted as a vulnerable group by the media, which probably, I mean, I know it caused quite a lot of distress among some older adults. And obviously there are all the lifestyle changes, not being able to meet up with your friends, not being able to go out and do what you want. Life became a lot less rich. And alcohol could be something for older adults where it was kind of a pleasure that they still had in their day, but also for some it became a bit of a coping mechanism. It was an escape from such a stressful and traumatic part of some people's lives.
But nowadays we talk much more about our mental health and well-being, and whether or not there's a relationship between alcohol and our mood, perhaps low mood and negative sort of connotations about life and lifestyle. Mm-hmm. Is there anything you found out in other research that you've done around that subject?
And that's something that I'm working on at the moment with my project for the Applied Research Collaboration in the North East and North Cumbria, where we're looking to understand better the lived experience of older people who have co-occurring alcohol and mental health problems, and think about what holistic and integrated and tailored support for older adults with these co-occurring conditions might look like.
Thanks for sitting down and having a chat with me about this. I just think knowing that research is going to translate into service delivery is a really positive end to our conversation today.
Thank you. It's been really great chatting, Kate. Thank you.